but surgical intervention is the only way to.
Is the only way.
Is the only way to cut the cancerous cells from the patient. Second way is to inject to vaccinize non-infected HPV individuals, but this is just a preventive, but not the ultimate treatment or preventive methods for especially Asian population, because the current vaccine can only prevent
Can only prevent
the healthy individual from HPV type 16, 18, type 6, and 11. But all these four HPV types is actually lesser common in Asia population. The most common HPV type in Asia population is type 52 and 58.
And until today, we have not been able to find the vaccine.
Until today, we are not be able to find the perfect vaccine
for these two.
So
my research
is study the HPV immune response in HIV population. For HIV infected patients, actually they encounter a lot of problems. They encounter a lot of problems. They also have easy to at higher chance to get other infections like CMV, Streptococcus, and also some other AIDS-defined illnesses like leukemia. So when and the current treatment for HIV patients, actually it can effectively to reduce the incidence of most of these opportunity infections. However, HPV.
Hands on.
However, the HPV infection never reduced.
Never
reduced in CAR-treated HIV patients. So, up to date, most of the studies that focus that assess the effect of CAR treatment for HIV population is only referred to clinical data, for example, the CD4 count and the cytological data, but they never go to the immunophenotype, especially for HPV.
Open hands.
For HPV specific immune response. Immune. So my study is to investigate the HPV specific immune response and try to look for the balance between TH1 T helper type 1 cytokine and also T helper 2 cytokine, because the imbalance of these two cytokines it may suppress the HPV specific immune response and also other infection in HIV patients. So we're trying to look for that and hopefully can get the answer.
Therefore,
I hope can finish the project.
You tell us for what? You tell us this for what?
hopefully this my outcome of this study can tell other study group not just to focus on the CD4 count and the cytology result to assess the CAR treatment in HIV patient.
What do you want us to do?
So far nothing.
So far, nothing.
Yeah,
Really, nothing.
really nothing. Hopefully can have other study group to carry out the same view, because especially in Malaysia population, I think maybe we are the only one. We are the only one.
We are the only study group.
We are the only study group focused on this problem, and we also hope that other study group come out with more data for Malaysia population and also for Asia population.
Thank you very much.